Hello and welcome to Shaka Extra Time. I am Paul Ndiho. Joining me on set is Shaka Sal himself, aka the Kawale Kid. Hello, Shaka.
Hello, Paul.
How are you, my friend?
I have to say that not only am I hugely terrific, but I remain simple, easy, and as some of our fans have suggested, an awesome son of Africa.
You know, speaking about fans, I ran into a lot of fans in West Africa who admire you. For some reason, they think you're the guy.
That I'm the guy?
Yes, they speak very highly of you.
Well, if that is the case, maybe I should take this opportunity to thank them from the deepest, better part of the bottom of my Kawale heart and soul for their compliments and support.
Interesting. Thank you, Shaka.
You're most welcome.
A warm welcome to you all. Our Facebook followers are watching us live. Shaka Extra Time is a show that comes to you every Tuesday. And today we'll be talking about a wider range of issues, but maybe we'll start right here and talk about the coronavirus. Shaka, this thing is scaring the hell out of people.
This thing is real, and in fact, it has really tampered with people's lifestyle. And no question about it. I don't know how it is going to end.
You know, I was surprised that with all the talk that has been going on, it looks like Africans, or at least for the countries where I was in Ghana and Nigeria, it looked more like those guys are more prepared to handle coronavirus than it is here in the United States. For example, when I landed in Accra, the first time I landed in Accra, I was subjected to all sorts of checking. You go through 2 levels of, checking to make sure that you're not bringing anything, or if you have any temperatures, they put you on the side. And the same thing in Nigeria.
Did anybody touch you?
Absolutely not. No, you stand in front of cameras, they scan you, and once they give you a clear, the cameras give a clear, then they let you go. But I was surprised that when I came back here, I did not even interact with an immigration officer at the point of entry.
Was it Washington Dulles International?
No, it was one of the busiest airports in the world, the Jackson Hartsfield in Atlanta.
Atlanta?
Yes, yes.
Nothing?
Absolutely nothing. I did not interact with any human being at the border. It was just me scanning my passport and handing the slip to a customs officer, and that's it.
Hey, Paul, I'm really glad that at least you come back from Africa with some good news that we ought to share globally. Because often, whenever you hear about Africa, almost everything you hear about, for the most part, is alarming. But in this particular case, I'm glad that you have some good news to report.
I mean, when you think about it, I was in Lagos, where they have had 2 cases.
The land of Oga.
Yes.
But those 2 cases also have actually been identified with foreigners.
Correct.
We're talking about French. Was it Italian?
Italian.
Yeah.
Yes.
Yeah.
And what was, I guess, what was remarkable was even the level of preparedness or seriousness that the people on the plane, almost everybody on the plane had a mask, flying from Lagos to Washington, because nobody wanted to be quarantined.
So did you have a mask too?
I had 2.
You had 2 masks?
Absolutely.
Right.
And on the plane, people were all, had all their masks on. But I was surprised again when we landed, everybody, whether it was the first point of contact, the people who came onto the plane to get some of the sick passengers off the plane, none of them had a mask on. So I was like, what level, how is the United States prepared to deal with this thing if they're really not taking it seriously at the points of entry?
Very interesting. And when you think about the fact that this is the period when you really do not expect a vaccine very, very soon. Yeah. In fact, scientists are saying that vaccine, probably we should be thinking in terms of, beyond 6 months, a year, and who knows, could even be 2 years for that matter.
In fact, I was talking to one of some health professional in Nigeria, and he said that maybe one of the reasons why they have done so well in terms of being prepared, it's because they have had cases previously of Ebola
yes.
and Ebola outbreaks and other outbreaks that have really put them at that level where their level of consciousness is at a very high level.
And in fact, if you remember, during those days of the Ebola virus, Nigeria stood out like a star country.
Right.
So I think that you are right. They learned some lessons, from that particular experience, and they seem to be making good on it.
And their ability to, for example, when the Italian guy came into the country, their ability to track the Italian, this Italian national from the point, from the airport to the 2 states where he went is remarkable. They were able to trace at least his taxi driver, the people he interacted with, within a very short time.
It's very interesting that you have such a huge problem with the coronavirus in Italy. Almost virtually the entire country right now is in pretty much a very uncomfortable state. Initially, you were talking about Milan, you were talking about the northern part of Italy, but as we talk, it is pretty much the whole country. How can you possibly quarantine a whole country?
Well, sometimes you have to do what you have to do. If that's going to stop the spread, which I doubt it will, you have to do that.
Look at China. China, where the epicenter is, that neighborhood, you are talking about in the neighborhood of 70 million people who pretty much have been quarantined, really. Can you imagine that happening here, especially with the democratic sort of system that we have here? It would be very difficult sometimes, some of these things to actually to be introduced.
Yeah, I think here what is going to happen here, it's individuals taking responsibility. If you think that by being in a public place, by sending your kid to a school is going to expose them to the coronavirus, I guess it's best that you probably avoid those places.
And also the municipal governments, county and state.
Yeah, and this is where politics has to be put aside, and for all these cities, states and federal government to work together. And because if they don't do that, chances are that this thing will spread. It doesn't need any visa, Shaka.
No, it does not need that, Paul. In fact, I think that everybody should pretty much take a cue from the leadership of scientists.
Absolutely.
This is a science thing.
In terms of impact, how much of an impact do you think a coronavirus is going to have on the global economy?
It's very unfortunate because I was reading somewhere that you could very well be facing an economic recession. You saw how, for example, the stock exchange is tumbling in Wall Street. You saw how, for example, the oil markets are pretty much tanking. And that is part of the reason is because people are not willing to travel. There are a lot of planes that can't even fly from one place to another, all that kind of stuff, because partly they do not have passengers. And the other is that a lot of countries have basically banned flights to and from China. And yeah, it's going to be a very huge thing, really. I think that it's going to affect a lot of people, especially when you talk about how these oil prices have pretty much collapsed. You can imagine some of these oil-producing countries. There's going to be a huge problem, and of course there will be spin-offs also, in the sense that there are also people who do things that benefit directly or indirectly because of the oil, trade and all that kind of stuff.
Let's go to our comments. Let's start with the Chais Idol. What's the level of Africa's preparedness towards the coronavirus disease in the event of a massive outbreak?
Well, at least you have told us about what you experienced in 2 countries, and it looks like there are also some other countries that are on the right track. The problem is when it comes to treatment, I think it will be a huge problem because a lot of African countries have actually leaders who do not even have a sense of confidence in their own essentially medical care systems, to the extent that, Paul, they routinely go abroad, if not overseas sometimes, for medical checkups. And that means that they really do not sort of feel for the people that they are supposed to lead. One could, in fact, say that they are socially, in some ways, psychologically insensitive towards the people that they are supposed to lead. So I think, I hope that it does not reach a situation where you are going to need a vaccine. It does not need a situation where you are going to need certain drugs and all that kind of stuff, because it could really, cause some havoc.
Africa has had very few cases compared to maybe Europe and Asia, but the numbers are rising. Some people have argued that maybe perhaps it's because it's still very hot in some African countries, especially like in West Africa. It's very, very hot around this time. Maybe that's why it hasn't spread so fast there.
There are some scientists, in fact, who have debunked that theory, that assumption. What is likely to be the reason is probably because there is no testing, really. If there is no testing, how are you going to find out how wide it has spread? I think there is no testing, just like in the United States, for example. It's incrementally coming, the numbers are incrementally coming up as they test and all that kind of stuff. So I think the jury is still out.
We spoke about how West Africa, at least 2 examples, Ghana and Nigeria, are like up there in terms of testing people coming in. But Festus here, Chuma, asks, is the East African member countries, are they prepared to battle coronavirus if it steps into its region? And we haven't had any case so far in East Africa.
At least we haven't been told about it. This may very well also have a relationship with where some form of democracy is working, where there is some kind of a system that reflects openness and all that kind of stuff. Because the 2 countries you have actually mentioned have gone through a series of elections that at least are considered to be democratic. But when you go to East Africa, your work is cut out for you in terms of democratic adherence. When you go to East Africa, you go to Central Africa, you go to North Africa, and what have you, democracy becomes a very alien idea. And you not be surprising that, for example, when you go north, look at Tunisia, even though Tunisia recently has come into the democratic sector. Look at Algeria. Look at Egypt.
Yeah.
Those kinds of things,
how about, this is a very interesting thought from Bo Sakina Sumbwa, Dear Shaka. The coronavirus is not a very serious pandemic like heart attacks and even normal flu. Even if it spreads so much, say in Africa, majority will still survive because it claims around 2 to 3%?
Well, we really don't know the exact percentage as yet to be sure. But what we do know about is that it attacks the demographic, for example, that is relatively older and therefore whose immune system is virtually weak, or those that have some kind of illness condition. For example, diabetes. If you are, for example, suffering from diabetes, you pray to the Almighty that you don't come anywhere into contact with somebody who actually has been affected by that. So it is something that people should be really very, very careful about, especially, again, those who are old and those who have certain, illness conditions and all kind of stuff.
At this point, what do you think the WHO should do?
Well, I think that so far the WHO, the World Health Organization, seems to be doing a good job in terms of sensitizing, at least governments, so that they can pass on the message to its people and all that kind of stuff. I think that the gentleman from Ethiopia, the Director General of the World Health Organization, Dr. Petros, he seems to be doing a good job so far.
Okay, I think that's a perfect segue. Let's move on to other things happening on the continent.